Good morning, everyone, and welcome to the Canopy Cafe on Tuesday, September 1st of 2020. My name is Ben Smock. I am the Director of Development with Canopy. And for those of you who are new to Canopy or just tuning in for the first time, we are a nonprofit organization that is growing Kentucky companies to positively impact people, our planet, and our future here in Kentucky. And we have some very important work ahead of us. We have some amazing brainpower that's gone into our work thus far. And we are excited to host these Canopy Cafes, which are conversations in good business with business leaders, nonprofit executives, civic leaders, folks that are committed to really improving the business sector and really operationalizing their good within their own businesses and making profound change for society and for our environment. And so we're happy to take these conversations to the digital space. And today we are very glad to welcome our guest, who is a Portland neighbor and longtime friend of Canopy. We do miss seeing her in our office building, Dr. Dawn Forbes, who is the founder and CEO of Nascend. And we will welcome Dawn here in just a few moments. But first, I would like to bring on my colleague, Alex Page. Alex has some good business highlights for us, and I believe she is tuned in. Alex, are you with us this morning? There she is.
Yes, I am. Hey, man.
Good morning. How are you doing?
I'm pretty good. Not too bad for Tuesday. Is it Tuesday? Yeah.
Yep, days blurring together. You know, somehow it's already September. Don't know how that happened.
I don't want to talk about it. That's insane.
So what do you have for us in the way of good business highlights this morning?
Yeah, the first story is actually about Salesforce, which I bet a lot of people are familiar with. So the company actually announced on Wednesday that they're extending the option for their employees to work from home until at least July 31st, 2021. So previously, all of their 49,000 employees were allowed to work remotely until the end of 2020. And they're hoping that this decision can help employees plan ahead even further, which has been a concept that's kind of been hard to come by lately. It seems like everything happens so quickly and you have to just act on the fly. So it's great that they're doing this for their employees. Salesforce is the latest of its peers to extend the option to work from home until next year. So places like Facebook, Google, Slack, and Uber are all companies that have done this already. And even some companies like Twitter, Facebook, and Slack again told their employees that they can work remotely even after the office is open. So Salesforce is also expanding remote work benefits for its employees, so giving each person $250 to purchase office supplies for their homes, which adds to the $250 that they gave to their employees earlier this year. And also parents have the option to take an additional 6 weeks pay time off. So Salesforce is really giving their employees a lot of opportunities. They're also even parents and guardians can also work from home past next August if they're in areas where schools are closed and students are doing remote learning. So it's great that they're stepping up and supporting workers, during this hard and confusing time. They even stated in an interview that they always stay up to date with governmental regulations to make sure that they're making the appropriate decisions whenever it comes to allowing their employees to stay at home longer or not. But it truly seems that if their intentions lie in keeping their workers safe and healthy. So the second story that I have is actually, it's about a nonprofit up in New York City. It's in Queens, New York. So there's a predominantly immigrant neighborhood called the 82nd Street Partnership, and it's home to over 200 businesses who've recently been very disproportionately affected by the COVID-19 pandemic. So a member of that neighborhood in an interview even stated that if you talk to people in the neighborhood, everyone knows someone that has either been sick or died from COVID. So because of this devastation, a new program called Neighborhoods Now, which was created by the nonprofits Van Allen Institute and the Urban Design Forum, has been formed to help under-resourced communities who have been hit really hard by the pandemic. So it pairs community organizations such as the 82nd Street Partnership with teams of architects and designers who work pro bono to help local businesses reopen and weather the current economic storm. So Neighborhoods Now launched back in May in 5 hard-hit neighborhoods across New York City, and each was paired with a team of designers from dozens of firms who volunteered to help them. So they've been collaborating directly with community groups to design ways to help businesses reopen, including everything from outdoor restaurant seating to multilingual signage about mask requirements to workshops on how to get loans from the government's Paycheck Protection Program. So it's great to hear that this just yet another nonprofit is helping a large group of businesses that are being disproportionately affected by this pandemic. And I just don't see this going away anytime soon. So the more that nonprofits are able to step up and collaborate with businesses, the better. So yeah, that's all the good business news I have for today.
Those are great updates, making sure that everybody is safe and healthy where they're working, either from home or getting back into the office, and then also finding creative ways to collaborate and uplift various sectors. So thank you, Alex, for stopping by the cafe and keeping us updated.
Yeah, no problem.
Okay, I'll see you later. All right. And we are very proud to welcome our guest today, Dr. Dawn Forbes. Dawn is the founder and CEO of Nascend, which is an education and technology company. It's a B Corp certified company, and they are working to create a new paradigm of care for infants and families that are affected by substance abuse disorder. And there's quite a bit of research that has gone into this work, and Dawn has done an amazing job getting this organization to where it is now. And she will tell us all about it. So let's welcome Dawn to the show.
Hi,
Good morning, Dawn.
Hi.
How are you this morning?
I am great. Excited to be here. Thanks so much for having me on today. Welcome everybody that's out there watching this morning.
Thank you. Well, we're very glad to have you. We miss seeing you in the office for sure, but it's nice to lay eyes on you virtually.
Absolutely. I feel like this is how I live, right? Like I'm always in a box on a screen, and sometimes 10 boxes on a screen, and about 100 times a day. So this is life now, right?
This is. So Dawn, you're the founder and CEO of Nascend, and the work that you're doing is critically important. You are one of 8 B Corps in the state of Kentucky. So please tell our audience a little bit about you and the work that you're leading with Nascend.
Okay, awesome. Thank you for this opportunity. So I am a neonatologist, and that's just a big fancy word for a doctor who takes care of newborn babies that when they're born, they can be healthy in the nursery. We take care of those, but we also very importantly take care of the kids that have complications. So prematurity, congenital heart disease, genetic anomalies, all those kids that often have to go into the neonatal ICU. And one of the populations of kids that here in Kentucky, about a decade ago, we recognized we were taking care of more and more often were infants that were born substance exposed. And commonly here in Kentucky, there's a lot of different ways that babies can be substance exposed, from moms who are on very critical medications that are important for their health and well-being, but unfortunately can lead to complications in the newborn, all the way to those who struggle with a really complicated disease of substance use disorder, or what you may more commonly know as addiction. And whether you're being prescribed medications or you're illicitly using, the impact to the fetus and the newborn can be the same. And so about a decade ago, as we started seeing more of these kids, just as a practicing doctor here within my healthcare system here in Kentucky, we began to try to figure out a better way to provide care. And we put together some really innovative guidelines and practices and dramatically improved our outcomes. Within our healthcare system, we went from treating about 60% of kids to only needing to treat 30%, having to treat for 45 days in the ICU, to now we treat less than 14 days in the ICU, and just really taking our program and focusing on better outcomes for the babies, but very importantly, better outcomes for the families. So engaging in the pregnancy to really try and improve the health of the mom, the well-being of the pregnancy, and the overall stability of the family, so that when a person is pregnant and they have a newborn, they then get to the opportunity to be a parent by taking that child home. So all of that happened as a doctor, and we did great work. And we kind of got to a point where within the healthcare system, we needed to make a decision about how we were going to go forward. And this decision was that me and several other neonatologists decided that we wanted a more global approach. We wanted to move outside of Kentucky. So we started Nascend. And Nascend very simply was founded to improve outcomes for the infants and families that are affected by maternal substance use, but not just at a local level, but at a national level. And that's what we've been doing since 2016. Nascend got up and running, and basically up until recently, I've been traveling across the country to other systems, to other providers, and even just general communities at large, providing education, training. We've developed some technology, which I'd love to talk about today, in order to just really make what we've done locally something that is scalable nationally, and really start trying to make an impact for better outcomes, healthier babies, and very importantly, healthier families.
Absolutely. That's an excellent description, Dawn. And I know when I was first introduced to you and your work at Nascend, I think the first thing that stood out to me was the amount of time spent in the ICU, postpartum. And I think that the understanding on a more holistic scale, the work that you're doing, and the fact that, as a proud Kentuckian, this work is starting here and with dreams to expand nationally is super important. So we're very proud to have your work featured here in the state. And to your point, you have some very important and timely work that has recently been launched, especially in this time of working virtually. And so Nascend Learn is a comprehensive online curriculum that has recently been launched. So tell us a little bit about that.
So just like everybody else, we've been impacted by COVID-19 and just the changes that we're seeing across our country and across the globe. I mean, because this is not just our problem. This is a worldwide problem. And in order for there to be a solution, this is going to have to be a worldwide solution. I think that's really important. But for us, just very individually, the training that we did, I mean, what Nascend looked like pre-March was me being on the road, physically out there in hospitals and healthcare systems. I mean, 270 days last year, I was up in the air and on the road and traveling.
Wow.
And I have been in a plane 3 days since March. So big changes. But when we suddenly, not only just as a company, like any company, finding that we couldn't continue to practice, in our day-to-day job, in our day-to-day environment, but also being a company that works directly with healthcare. I mean, the people that we're training are the healthcare providers and the social workers and the community people that are right out there on the front lines with COVID, suddenly having this double whammy of not being able to do our job. And even if I could, the people that I do it with just aren't available because they're overwhelmed with other responsibilities, made us really have to stop and think how we were going to move forward. And we were very lucky, and I'm thrilled that I have such an amazing team of people that have worked with me, because we basically took a handful of videos that we had been sort of with a vision creating over the past couple of years, but never really got it together. And we were able to go from that handful of videos to 18 online courses that allow a provider in their own time, at their own pace, to go from everything about prenatal intervention all the way up to 3-year pediatric follow-up and everything in between for the substance-affected infant and family and mom, and have an online learning experience. And although, again, I still firmly believe that live training and live education is the most beneficial and the most impactful, in a time when that's not possible, I was really proud of my team for being able to recognize that this was our opportunity. So we launched Nascend Learn in the end of June, and we're really excited. It's for all healthcare providers and anybody across the space, whether you actually practice medicine or you're part of the social support system in the community or in the healthcare environment that takes care of these infants and families, works with adults of substance use disorder and addiction, obviously focused on maternal and women and pregnancy. But it's really been our way to try to continue to put information and education and training out there in a obtainable, usable, and accessible way, given the change in our times now. So we're pretty excited about Nascend Learn. 18 courses, all with continuing education, physicians, nurses, dietitians, other components of healthcare, right there ready. And so what we've been doing is just trying to figure out how we make this the most accessible for the healthcare providers and the communities right now.
That's outstanding, Dawn, and I applaud your work and the ability to pivot in the midst of the times that we're facing, and to create something that's very meaningful, very important from a healthcare perspective. And so I think this program is wonderful, and that it really provides ongoing professional certification for those working in the healthcare fields, and also there a growing list of courses. And so the goal is to continuously expand.
Right. Absolutely. And cannot emphasize enough how important it was for the group of people that came together to do this. I mean, again, we pulled together at a time where people were getting laid off and jobs were uncertain. We were able to pull in our consulting teams, and even though there wasn't a guarantee that there was going to be payment on the other end of this, I had some amazing people from different consulting companies, Ryan Industries, Vantage, all these people came together. My staff directly came together and said, this is meaningful, this is important, this is what we can do now, so let's pull together and do it. And we did in about 2 months what would probably have taken us 2 years any other circumstances, just because everybody was so dedicated and committed and gave so much of their time and resources very willingly. And like I said, without even a guarantee of payment. So again, I just can't express my gratitude enough for the hard work that was done and the amazement at what we accomplished in such a short period.
Teamwork makes the dream work. That's amazing.
Absolutely, absolutely.
So Dawn, you mentioned a key word in there in regards to what one of the purposes with delivering this Nascend Learn program, and that's accessibility. And from your standpoint, so your company is a B Corp certified company, which means that you are globally recognized as a business that stands for social and environmental regard, and that you operate your business with the highest ethical standards, and everyone across the globe knows of the B Corp seal of approval for good business. And Canopy is created to create accessibility on a local level, and so Nascend is also a letter of intent signatory to enroll in the Canopy certified program. So tell us a little bit from your perspective what it means to be a B Corp and why you're excited about the Canopy certified program.
Yeah. So when we set out to become a company, so I'm a doctor, started a company. Craziness, right? I mean, I have no business training whatsoever other than the day-to-day management of, being in a practice. I can't even say I managed a practice. So we really thought about what kind of company we wanted to be. And there's lots of different ones. And we are an LLC. We're a limited liability company. And that's what we knew we needed to start as. But it was really important to us. We were aware of B corporations. We were aware of B Lab, which does the global certification for B corporations. And that just felt right. I mean, it's a standard, not just that we say we're going to do it, we have to prove that we're going to do it. So on a daily basis, we have to do things like putting people before profit and progress before profit. We have to take care of our environment. We have to take care of our community. And that all just felt right to me and the others that were part of starting this company up. So we went through the 2-year process, very rigorous, very demanding, and even a little costly in order to become a certified B corporation through B Lab. So fast forward a couple years into our process, and that's when you guys came on the scene. And what I'm really excited about Canopy is that it's local, right? So B Lab is great, and it's a global organization, and yep, globally we're on that list. We are a global B Corp certified B corporation. But the cool thing about Canopy is that it's here, it's local, and it's how we can work together as local B corporations within the state of Kentucky, and even branching out to our surrounding states and neighbors to really make a difference at this level, not just in what I do as an Nascend, but what we collectively as a group of businesses can do for our community, for our environment, for other companies, how I can help other companies, and other companies have been so willing to work for me. I think Canopy is just a great way to bring this all together and not only help those of us that are already here be sustainable, but help others that want to get into this and to really use their business to make a difference, not just make a profit, not just make a product, but to make a difference in how we treat our employees and how we train our employees and how we protect our environment and what we do to just give back. And what better way to do that than through a company and then collectively doing it? Because one of the things that we're excited about Canopy is when we're up and running and the certification's in place and we're excited to be Canopy certified, we're looking forward to that. And I'd love to know where that stands, is that the opportunity to say, okay, not only can we use business for good, but together we can make our businesses better. We can collectively do things and decrease cost and help startups. I mean, I'm a company with a really small set of employees, but it is imperative to me that they have full benefits. Well, a small company offering full benefits is complicated and expensive. But a collective of small companies that are doing that, it improves the quality of your community, of the people in your community, and the lives of the people as well. So I think Canopy is really meaningful and important, and excited to be one of those first Canopy certified.
Absolutely. I'm very glad that this is recorded because we're gonna we're gonna have to circle back to what you just articulated extremely well. Thank you for your kind words, Dawn. And you really hit the nail on the head. You can tell that we've been neighbors for the last couple of years, right? And so we're really understanding a lot about each other's work. And you're spot on. I think that that effort from a local scale, creating accessibility for smaller and mid-sized companies, creating that connection and accessibility amongst Kentucky businesses will lead to helping solve some of our toughest, most deep-seated social and environmental challenges. One of the reasons that Canopy was started was because Kentucky consistently ranks more poorly than we would like in some of the metrics that really matter, and that's in regards to education and health outcomes and things of that nature. And so you're absolutely right. We can create this ecosystem in Kentucky that is supportive and connected, and we can really start to drive business results. We can really solve some of these tough challenges, and we can improve statewide economic development overall. I mean, absolutely. That's a goal of ours too. And what we absolutely foresee for our work is being able to attract and retain those that have this mindset of good business and want to impact locally and be a beacon globally. Absolutely. And Nascend is a wonderful example of that.
Thank you.
And to your question about the Canopy certified program. And so for those watching, so we had, several organizations that signed the letter of intent first, and they were Nascend, they were Facilities Management Services, and D.B. Williamson. And so Nascend has obviously been with us since the start. And in November of this year, we are rolling out the Canopy certified program to a group of companies just to kind of be like a soft launch, if you will, to make sure that everything with the online program is functioning properly and that we're providing the service in an adequate way. And then beginning in January of 2021, we will start rolling out to larger groups. And the first one will be of about 20 businesses or so pursuing the Canopy certified program. So it's complete. We've put an incredible amount of work into it. And so Alex, who was on earlier, and El Shaddai and Scott and Amanda and the full team have all input into this program, and we're incredibly excited to roll it out beginning in November. So more to come soon, Don. Stay tuned. We'll be in touch with you.
All right, I'm ready. Let me know.
All right, good deal. We're ready too. Trust me. So Don, I want to ask you, in regards to where you are right now organizationally, just launching Nascend Learn, dealing with the complexities of a global pandemic. What are the opportunities for you to expand your work right now?
Yeah. So one of the things, now that we have this online platform, right? So obviously the goal of this online platform is to get training out there more accessibly and easily and affordably, right? Because online is definitely less expensive than live. So goal number one is how we get that out there. But one of our two big goals. One is that we need to make sure Nascend Learn is really accessible. Not just they can get to it, but that people can afford it. And we're reaching out to healthcare workers. These are the people that are going to benefit the most from this training. And it's not even the big systems. Here in Kentucky, it's our smaller level 1, level 2 hospitals that take care of the majority of the substance affected infants and families. It's not the big children's hospitals that have money and resources and funding. It's our smaller ones. So we are trying to figure out how we can bring people in, sponsors that want to help us, partner with us in order to make this program accessible for free. Because right now it has a cost. So we want to try to get big sponsors to come in. We want to work with organizations and companies that are working in our same population, that have some of the same goals that we have, so that when I go to a hospital and I talk to them about training and they tell me that these are their problems and this is what they want to do, I can say, great, we have a sponsor that can help us with this. We can make this available through grants and through free funding. And again, we are a for-profit company. We're not a nonprofit, but what we're trying to do is train a lot of nonprofit and even for-profit hospitals at a time where there's no money for training in healthcare, because all of that money is going to, personal protective equipment, right? So that we can all be protected from COVID and all the things that we're being exposed to today. So how we can get this funded to make it more accessible and more available available to those that are going to benefit from the training. The second thing is that, like I said, we were a live training company, and we not only provide some interactive education, but we truly can help a hospital totally change their system, just like we did within our healthcare system. So we're trying to figure out now how we take all of that from the live and put it into virtual, and we are getting ready to roll out our live virtual component of training, where it's one-on-one sessions with me. We can actually be a hands-on but virtually and remote opportunity to start changing the infrastructure and the guidelines and the protocols and what you do within your system. And that's our phase 2. So hopefully by the end of the year, we will have converted our entire live series and live training all the way to a complete live virtual, which means someday we'll be able to go back into the live world. We all aspire for that. We all want that interconnectedness and being able to be one-on-one and face-to-face without technology in between us. But in the interim, we've still got to figure out how to keep improving the outcomes for these infants and families locally, nationally, and maybe even someday globally. So that's our 2 big goals for right now.
Wonderful, wonderful. And it's been quite evident throughout the duration of this show. One question that we ask all of our guests, because Canopy's vision is to make Kentucky first in good business, what is your definition of good business, Dawn?
It's what we aspire to do every day, to make sure that we're focusing on people, environment, and community, and that everything we do improves the outcomes of all of those around us and benefits those around us, protects our environment. But good business is doing good for people.
Well said. Well said. I love it. I love it.
Thank you, Ben.
And before we part ways here, I want to leave our viewers with information on where they can go to connect with you and Nascend and to learn more. So where can people go?
So Nascend.com, that is our website. It has everything on it about who we are, what we do, what our outcomes look like. And there's right at the top, there's a button that's green and it says Learn. Click on that button. That'll take you to our Nascend Learn, which is our online training. If anybody wants to do this individually, absolutely, it's right there. If you're a hospital system or healthcare provider and you want to make it, you want bulk pricing or bigger purchases, reach out to us. We'll work with you. We'll try to figure it out. Again, we got to be sustainable, but our goal is to get this training out there and to improve the outcomes for these infants and families, and just to make the healthcare provider's job easier and more satisfying and less frustrating.
Absolutely. Thank you, Dawn. Well, we cannot thank you enough for coming by the Canopy Cafe, for your long-standing and consistent support of Canopy. You truly are a dear friend to us, and we can't wait to see you again in person, and can't wait to get started with the Canopy Certified Program and Nascend.
Great. Thanks so much, Ben, for having me again.
Oh, looks like we might have lost Dawn there at the end. Anyways, for those of you listening, please connect with Dawn and the amazing work at Nascend. Go to nascend.com and learn more. And that almost wraps us up for the show here today. Before we part ways, I want to bring to your attention several ways that you can get involved and support Canopy's endeavors right now. The first of which is to sign the Charter for Good Business. We are trying to generate as many signatures as possible of people, Kentuckians, business owners, nonprofit employees, anybody who believes that good business practices should be applied throughout Kentucky, and that together we can accomplish some amazing things. So if you believe that that good business is the way, you can go online and sign our charter. And let's see here, I believe it is charterforgoodbusinessky.com. Go there to sign up and to add your name to the list. Also, we are participating in Gift for Good this year. So Thursday, September 17th, Canopy is trying to raise $10,000 for our Gift for Good approach. And anybody listening, we would love your consideration of support on this day. We have incredibly important work ahead of us with the Canopy Certified Program. We've completed everything and we're ready to go. So if you all are able to contribute and support our mission, please do. You can learn more at canopyky.org. And again, Gift for Good will be Thursday, September 17th. So stay tuned for more. We'll have a festival in good business, a bunch of great folks getting involved, artists and business leaders. So stay tuned on Canopy's social media, and we appreciate your support. So that wraps us up for the Canopy Cafe today. I thank all of you all for stopping by and hearing from our friends at Nascend, and we'll see you next time. Take care.